Health Studies Collegium Foundation, 21st Century Immune and Hormonal Tolerance, Resilience, and Vitality. Hopefully you have that and want to keep it, or if you don't, you want to know how to restore it and maintain it. I am, on the next slide, you can see who I am. I'm Dr. Russell Jaffe. I am founder of Health Studies Collegium, where I'm a senior fellow. I maintain a fellow status in a half a dozen different academic, clinical, and research societies. I'm founder and continue to lead PERC Integrative Health, provider of the PIH Academy certification program, ELISA Act Biotechnologies, where we do novel cell response assays, high quality, high precision assays that we'll talk about, and we help explain how to use that information for a healthy lifestyle in the 21st century. And yes, there is RMJ-HRX, which has a promising cardiovascular platform and pipeline. But today I'm Dr. Russell Jaffe. I studied internal medicine and biochemistry at Boston University. I helped found the Certified Clinical Nutrition Organization, the IAACN, and I was privileged to be their education director for the first 8 years of that organization. And you can reach me in any variety of ways, including on the bottom of this slide. And on the next slide, we take a look at where we are going. Adrenal balance, restorative sleep, enhanced mood, and immune homeostasis. Now, homeostasis is a lovely word coined in the early 19th century about self-regulation, bringing ourselves back into balance and equilibrium when we are pushed or stressed. So we do need to briefly review adrenal physiology basics, circadian rhythms, and the HPA, hypothalamic pituitary adrenal axis. We have to look at toxins and how they relate to sleep and mood, among other effects. We look at the immune system connections, because it is a system, and it's dynamic, and it'll talk to us if we know how to interpret the information. Then we're going to look at essential nutrients and nature's alkaline way epigenetic recommendations using physiology before pharmacology. Now on the next slide, we begin to unfold this issue of stress and distress. And here I'm old enough to have remembered and actually learned from Sir Hans Selye, the scientist at Montreal at McGill, who really did the primary original studies showing that a little bit of stress will get you up and going, and too much stress is distress and will kill you. And as you see in that little cartoon, it says, according to research, the average human body is 20% water and 80% stress. Now, in fact, we are 80% water, and what we do with the other 20% is largely up to us. And so there's stress that can cause anxiety, which means living in the past, and that leads to depression. Or you could live in the future, and that causes another kind of problem. So you want to live in the moment. And are you a weeping willow? Are you a quaking aspen? Are you a worried sequoia? Are you in the lower left one with sweaty palms, queasy saplings, or a bonsai, calm on the outside, screaming on the inside? So there's lots of expressions on the continuum of eustress that's helpful, mid-stress that is okay and manageable, and distress, which will wear you out and wear you down. And we see on the next slide, in the center you see the adrenal medulla, which means the middle of the adrenal. And it's responsible for turning the amino acids tyrosine and phenylalanine into norepinephrine and epinephrine, that is noradrenaline and adrenaline. This is the quick energy that you need from your adrenals to support the sustained energy from your thyroid. And then you see at the top of the slide the adrenal cortex, and that is responsible for the hormones that come from specific precursors, including cholesterol and certain fats. And these are aldosterone, estrogens and androgens, DHEA and cortisol that need to be in balance, pregnenolone, progesterone, which are the sources for the testosterones and the estrogens. Now, DHEA you can think of as the mother hormone, the feel-good anabolic hormone that promotes immune system health and youthful vitality, remembering that it's always about balance. If DHEA and cortisol go up and down in balance, you're in homeostasis and healthier. If one goes up and the other doesn't follow, or if neither go up under stress, then you're in distress, you're in exhaustion, you're in survival mode, and we want to get you back into healthier, elective, protective mode using nature's alkaline way. Now on the next slide, we dig a little more deeply into low adrenal function. It's associated with fatigue. I don't mean being tired from staying up too late. I mean, regardless of rest, you're still fatigued. It's about the most common reason that people go to physicians. More than 80% of people in the waiting room of doctors will tell you that they're not getting restorative sleep. They have uncontrollable needs to eat from time to time. Not 100%, but often enough, especially in the middle of the night. They're subject to mood swings rather than mood stability and to brain fog rather than brain clarity. And we want to bring back controllable edibles and healthy nutrition. Let medicine be your food and food be your medicine. We want your moods to be stable and your brain to be clear. On the next slide, we look a little more deeply. There is something in the brain called the hypothalamus. This is in between the pineal gland and the pituitary. The pituitary we talk about as the master gland, pituitary adrenal HPA axis, hypothalamic pituitary adrenal axis, the stress system, the response system, as pretty much defined by Hans Selye, who said from the middle of the brain, depending on the harmony in that deep part of your brain, there are releasing factors that tell the pituitary, literally drip chemicals on the pituitary that say releases ACTH, adrenocorticotropic hormone, that goes to the adrenal gland, that tells the adrenal gland to pump out cortisol that will modulate the immune defense and repair system. And then you get feedback from that cortisol to the brain, in the best of cases saying, okay, we got enough, thank you very much. You see on the left side of this slide, chronic activation means prolonged distress or prolonged stress, failure to turn off the people who can barely sleep at night because they're so busy being restless in their sleep. People who are concerned about burnout, about anxiety or depression ruling their lives or being in the background. And the role of early life trauma, very important. And as we see on the next slide, and some of this comes from colleagues and other fellows of the Health Studies Collegium, if you look at the vicious cycle, which is the common one, and we want the virtuous cycle, not the vicious one. If you look at the vicious one, start at the top, makes the body less able to respond to stress. Then there's more stress that stimulates the adrenal glands to produce more cortisol. Cortisol goes up initially, DHEA doesn't follow. Over time, this causes adrenal exhaustion and low cortisol. So even when you should come up, when you provide it the caffeine or other stimulants, it doesn't because the exhaustion has become so severe. So eustress equals an increase in DHEA in proportion to cortisol. Distress on the bottom of the slide means an increase in cortisol and a decrease of DHEA, and exhaustion means that neither of them go up on stimulation. Now the next slide, you've heard me say that most people have overstimulated and exhausted their adrenal capacity, so you wouldn't want stimulating herbs. You'd want adaptogenic. You'd want herbs that in combination cause adrenal support rehabilitation and improvement in these chronic conditions. And we specifically recommend rhodiola in the rosea form. Callus means the root, the rose root rhizome. It's been a traditional medicine in Eastern Europe and Asia for a long time. There's evidence of benefit in decreasing depression, eliminating fatigue, mood, stability, restoring sleep. and biorhythms, improving irritability, unexplained headaches, and concentration. There is a literature on this. And on the next slide, the adaptogenic formula that we recommend includes very specific form of Magnolia officinalis combined with a very specific Philodendron amarans extract. The Magnolia is a tree native to Asian rainforest. The bark has long been used for stress and anxiety modulation and improvement. The Magnolia and Philodendron work together by binding to stress hormone receptors in the nervous system, both in the gut nervous system and in the central nervous system. So it supports and restores cortisol DHEA hormone balance. It promotes relaxation and feelings of well-being. It's not a sedative. It does not sedate, but it does reduce stress-related eating. So you want to use things like Adrenal Distress Guard, nature's combination of adaptogenic support for your adrenal glands. Now on the next slide, we use the healthy oil that enhances each specific combination of nutrients or herbs in regard to their uptake. And so here we found perilla oil, rich in MCTs, medium chain triglycerides that alkalinize. We micelize those adaptogenic herbs to enhance their uptake and chaperone their delivery where it's needed. Perilla oil is omega-3 rich, that enhances repair and is helpful for people. And the medium chain triglycerides reduce cell acid load. They are actually short chain and therefore they alkalinize. They enhance assimilation or uptake. They improve metabolism. And that's why we use perilla oil in this adaptogenic adrenal support combination. On the next slide, what we recommend based on our community-based observational studies are that in just 6 weeks, you can repeat the cortisol DHEA levels in the serum or in the plasma if you want, but you can show improvement in just a month and a half in the cortisol DHEA levels in saliva taken at 4 different time points. This is a non-invasive, salivary-free hormone because saliva is an ultrafiltrate to some extent of the plasma. And yes, you can measure blood plasma hormones as was done by Feynman and others many years ago, or today the saliva non-invasive is what we recommend. You have 4 different time points, typically 7 a.m., 11 a.m., 5 p.m., and 10 p.m., but 4 different time points, and you look at pre and post evaluations, and we're saying in just a month and a half, not in a year and a half, in just 6 weeks, you'll see substantial and beneficial improvements in the cortisol DHEA levels and biorhythms. On the next slide, we look at results of the 6-week outcome study that we performed in the community. And what you see is improvement across the board. So the black diamonds are before, the magenta squares are after, and we achieved significant improvement, and that means statistically significant improvement, before and after, in both the amounts and the rhythm. Now, these were ambulatory people. There are worse people that will come into your clinic, but the results are unmistakable. We do real and original science and publish and let you know the meaningful results. And notice there is a significant variability of individuals, as you would expect. And we are pleased to report original science in support of Adrenal Distress Guard, an adaptogenic formula to improve cortisol and stress hormone, cortisol DHEA balance, hormone fluxes. On the next slide, the 21st century. We're in the 21st century and it's harder and harder for the adrenals to stay balanced. We want, in essence, relief from the stress tax of high-tech living. We want to avoid afternoon crashes that often require caffeine followed by some kind of recreational alcohol or other substance. We want to repair that HPA axis naturally and adaptogenically. We want to get restorative sleep. We have suggestions of lifestyle that improve your energy level and the restorative qualities of sleep. We want to combat food cravings and uncontrollable binges. We want to rebuild immunity, tolerance, and resilience, because that's what homeostasis is all about. So on the next slide, we see the relationship between stress and distress and pituitary activity. You can measure in the blood. And this was done at one time while people were sleeping. You can measure a pulse of growth hormone, prolactin, LH is luteinizing hormone, and oxytocin. They all come out at the end of a certain phase called REM4, deep sleep. They come out in a very short period of time, 5 minutes, as does TSH, which stimulates free T3 and free T4, plus or minus reverse T3 for those with acidosis. You might want to also look at the ACTH cortisol DHEA levels, because stress affects sleep and sleep affects stress management. The next slide shows us the lack of restorative sleep. This impairs resilience. It makes you more irritable. It reduces your endurance. It reduces your productivity. It really stresses your immune defense and repair system. It can result in memory problems, reversible but measurable. There are heart issues, especially hypertension and atrial fibrillation, among others. There's usually a problem with weight control, and at least 60 million Americans suffer from sleep-related disorders. At least 60 million people would gain from our Nature's Alkaline Way to restorative sleep protocol. In half an hour, you prepare for, and then you engage through green light and stretching, the process of slipping into restorative sleep. On the next slide, you see what I was talking about before in terms of these rhythms. In this case, the cortisol is in black and the melatonin is in red. Notice that cortisol should come up before you wake up. So cortisol should be on the rise usually an hour or two before you're going to get out of bed. And when you get out of bed, in addition to gratitude for waking up, your cortisol should be peaking at that point. It generally goes down until the afternoon and then comes back up in the evening or night. Notice melatonin is counter-cyclical. During the day, melatonin is not in the body. Melatonin comes out during that REM sleep as a pulse and is generally used locally where it's needed and made, such as the pineal gland and related deep brain structures. So the notion of using melatonin as a supplement is really pharmacology of a natural substance. We recommend precursors like enhanced uptake tryptophan that allows the body to make what it needs in serotonin and melatonin where it's needed and used briefly because it's too powerful to flood the body. On the next slide, we see what, in essence, the circadian biorhythms and sleep are all about. The rise in serotonin. Remember, serotonin comes from tryptophan. A rise in serotonin with some conversion to melatonin where needed, and a concurrent fall in cortisol and adrenaline is required for transition into sleep. So in order for us to fall asleep, serotonin has to rise and adrenaline and cortisol have to fall. What if the adrenaline and cortisol are on alert and they don't fall? Well, you'll be tired, but you won't fall asleep. What if the serotonin doesn't rise? You'll be exhausted, but you still won't fall asleep. So serotonin has to rise. The serotonin coming from tryptophan, we have enhanced uptake tryptophan to convert into serotonin and melatonin where and as needed. And then you want the cortisol stress response, the adrenaline stress response to calm down, to reduce, so that you drift off to quality and restorative sleep. On the next slide, we look at this sleep cycle, starting with tryptophan at the top left, going to 5-HTP, which stops hunger, going to serotonin, which alleviates depression, obsessive disorders, migraine, and fibromyalgia much of the time. The serotonin can then be acetylated and then deacetylated to form melatonin that promotes sleep. So many benefits from enhanced uptake tryptophan in the brain, central, and gut. So the gut nervous system and the central nervous system have exactly the same nerves, receptors, activities. Now we know there's a bidirectional highway called the vagus highway that communicates between the two. And we recommend enhanced uptake tryptophan about a half an hour before sleep. And then it can be repeated in the middle of the night because it's not habit forming and it doesn't cause feedback suppression, which would happen if you gave serotonin inhibitors and or melatonin as a supplement. So next slide. Tryptophan is an essential amino acid. We get it from certain specific foods. It enhances melatonin production along with serotonin. It stabilizes circadian rhythms. It improves relaxation and mood balance. It increases delta wave deep sleep. That's when those pulses of restorative surveillance come out. Does not produce grogginess or brain fog on waking. And actually, there is literature going back to the 1980s of how safe and effective is enhanced uptake tryptophan as an essential amino acid, meaning you've got to take it in from the outside. You can't make it in your body. The next slide. We look at the issue of should you take tryptophan or 5-hydroxytryptophan. Tryptophan is the source. This is in the middle column. It needs to cross the blood-brain barrier, but it does. It is helped by having enough B complex, which means enough NAD, NADP, niacin as an example of B vitamins. It's optimum when taken on an empty stomach, as is true for all amino acids, and you get enhanced uptake when you concurrently take nature's B6 and zinc in bioavailable forms. It is safer, healthier, and sustained for long-term use. It has few drug interactions. In contrast, the right side, the 5-HTP, it's a downstream metabolite. It does cross the blood-brain barrier. However, it gets diverted. And if you notice the absorption, the quick uptake and metabolism goes to quinolinic acid. That's an excitoneurotoxin. You don't want quinolinates in your brain, either central or gut. And so flooding the body with 5-HTP is a short-term benefit with a longer-term risk. We don't recommend that. There are more drug interactions with 5-HTP that have been documented over the many years. And we rely on enhanced uptake tryptophan along with adequate B vitamins, along with adequate magnesium choline citrate, along with antioxidants, including ascorbate, along with bioavailable minerals, including zinc. And now you have a symphony that plays in harmony. On the next slide, we look at detoxification, which largely happens when we're asleep. So there's an interrelationship between the quality of our sleep and the quality of our body's ability to cleanse itself. Sleep cleanses the brain, and then the brain cleanses the body. Classic aphorism is a good night's rest literally clears the mind. However, presence of toxins, anything that's an anti-nutrient, hormone disruptor, or solvent, or toxic metal, or mold product, or isotope, any of these anti-nutrient toxins affects the normal hormonal cycle necessary for quality sleep. Now, on the next slide, we get a little bit more complicated. I am a biochemist. We're looking at the organic acid sources and metabolites, starting on the far left, 2 amino acids, phenylalanine and tyrosine. Tyrosine goes to the thyroid hormone, as in T4. If you don't have enough tyrosine, you won't make thyroid hormone. But tyrosine also converts in the nervous system, both gut and central nervous system, to L-DOPA, which with the help of B complex and B6 goes to dopamine, which with the help of copper and vitamin C goes to adrenaline, noradrenaline, and the parallel molecules. So you have noradrenaline generally more in the brain than in the body, and you have adrenaline, epinephrine, generally more in the gut nervous system and the body more than the brain. Now, thyroid hormone is very important coming from tyrosine. But tyrosine is also needed for L-DOPA, as we said, going to dopamine, and its urinary metabolite you can measure, that is in the urine, you can measure HVA, homovanillic acid, homovanillate, HVA. And then you can look downstream at norepinephrine and epinephrine. Their urinary metabolites are VMA, vanylmandelic acid, VMA, vanylmandelates. And for many decades, neurochemists have been measuring in the urine certain metabolites derived from amino acids, but are reflective of their metabolism into neurochemicals, neurotransmitters, and the like. On the next slide, we look at this issue of tryptophan going to 5-HTP to serotonin to melatonin, all of which is fine. But if you start with 5-HTP, you end up with too much kynurenate. It goes too fast and gets metabolized to the excitolneurotoxin more than tryptophan, which comes in slowly and is used where it's needed. There is a little bit of kynurenate, especially in people who lack B vitamins. What you want is enough B vitamins and ascorbate, enough magnesium choline citrate, and enough adaptogenic adrenal support so that you don't form the excitolneurotoxins. Serotonin does go to 5-HIAA, 5-hydroxy-indole acetate, or acetic acid. 5-HIAA is the serotonin metabolite that you can measure in the urine. Some people are hypermetabolizers. They'll quickly convert serotonin into its metabolite, which is not beneficial or active. You want to calm that process with biodetoxification and this nature's alkaline way approach. You want to make sure that people have enough B complex and B6, but more importantly, all the minerals and all the cofactors, all the antioxidants, all the symphony players that form the symphony of life. On the next slide, we see that there have been very detailed studies showing that if you compare just 100 years, 1900 with the year 2000, industrial chemicals are up 15-fold, that is 1,500%. And if you look at pregnant women at the time this study was done, which was some years ago, that is about a decade ago, of all pregnant women, the average pregnant woman delivering a baby in the cord blood that fed the baby had 43 or more xenotoxins, anti-nutrients detectable, and the synergies almost not studied. So we conclude a need, urgent, pressing need for safer biological detoxification. On the next slide, here we give you the kitchen solution biodetox superfoods. These are all rich in sulfur that gets the bad stuff out. This is garlic, ginger, onions, broccoli sprouts, and eggs. The acronym is GGOBE, garlic, ginger, onions, broccoli sprouts. All sprouts are good. Broccoli sprouts are particularly rich in sulforaphane, IP6, and other minerals. Eggs are high sulfur and they are excellent foods, especially if they come from ducks, goose, or quail sources. If it's a chicken egg, I would urge you to get at least organic, if not biodynamic sourced, because otherwise, from the arsenic to the other anti-nutrients, the chicken eggs of today are not what we would like. So biodetox starts with GGOBE, garlic, ginger, onions, brassica sprouts, and eggs. And we have chapters in an invited textbook on bioactive food as dietary interventions for diabetes, and other chapters invited by those editors. And we're happy to share those with you. Glutamine recycled by PAC. This is something we pioneered. Glutamine is the energy source for the lining cells of the intestine. PAC recycles it about 10 times. So if you follow our guidance, you get the benefit of the glutamine and never, never, never build up glutamate. So recycled glutamine, highly recommended, along with GGOBE. And now the next slide. Something synergistic in the biodetox family individual ascorbate-based intake based on oxidative stress, called the ascorbate calibration or the C cleanse. Healthy people use 1.5 grams, which is half a teaspoon, every 15 minutes in water or the beverage of your choice. That means 6 grams an hour, and most healthy people will cleanse within an hour or two. For moderately ill people, twice as much, that is 3 grams or a teaspoon every 15 minutes, 12 grams an hour. Most moderately ill people will cleanse within an hour or two. For the chronically ill people, now you start with 6 grams, 2 teaspoons every 15 minutes, insufficient liquid. That's 24 grams an hour, and sometimes people need a surprising amount to cleanse. And we suggest continuing to that flush or cleanse. If the first time around you started on a modest amount, you can come back another time, maybe every week, and repeat the ascorbate calibration C cleanse. People with chronic illness and comorbidities often benefit from having probiotics, the recycled glutamine pack, magnesium choline citrate, and polyphenolics right before and sometimes in the middle of the cleanse. And on the next slide, we see that there is a mood and sleep relationship with methionine. Now, methionine is an important amino acid. It reduces excitoneurotoxins. It makes your mind less jumpy, makes you better able to relax into sleep. It reduces depression, anxiety. Healthy methylation depends upon methionine, and L-methionine is preferred to S-adenosylmethionine methionine because methionine itself is available in the free form, high purity, less expensive, more stable and functional. So yes, people did give some decades ago S-adenosylmethionine methionine. Then we found out that actually giving the free form amino acid methionine helps restore that methylation system and cycle. On the next slide, we look at another mood-sleep relationship. Here, the amino acid glycine. It's a simple amino acid, but it enables more restful sleep when you have enough of it. It supports healthy serotonin. It helps normalize circadian rhythms. It decreases fatigue and improves clarity. And it is often depleted because it's needed in lots of places, including by the liver for metabolism and detoxification. So sometimes you need to induce glycine by having healthy intake of glycine sources. You want glutamine, always recycled with PAC, to reduce stress, depression, and anxiety and increase GABA. And on the next slide, we get to restorative sleep. It is a choice. Restorative sleep can be chosen when you start with a salt and soda bath. That is a half a cup each, half to 1 cup each of Epsom salts and baking soda in a warm tub of water, and you soak for 20 minutes. During that 20 minutes, you do 5 minutes of abdominal breathing. For extra credit, you can have a dichromatic light either in your bathroom or near your bed. My suggestion is no electronics in the bedroom. You can power down the Wi-Fi if you have control of it. I suggest no after evening caffeine or intake of heavy metals, but I do suggest the use of enhanced uptake tryptophan 30 minutes before sleep, just before you get into that salt and soda bath. I do recommend checking the morning urine pH after rest to determine how many doses of magnesium choline citrate you need. I do recommend vitamin B6, but particularly enough B complex to keep your urine sunshine yellow. Well hydrated, but sunshine bright yellow. On the next slide, we look briefly at the autoimmune common conditions. When this Venn diagram, those overlapping circles that have to do with genetics, transgenerational influences, dietary choices, infectious exposures, and toxic exposures, when they overlap, there is self-attacking autoimmune disease. At least 23.5 million Americans, women more likely to be diagnosed, at least 80 different conditions according to the Autoimmune Related Diseases Association. And autoimmunity is really different from autoimmune disease. So you can be in a repair deficit inflammatory autoimmune state and get out of it quickly, or you can be chronically in that state and end up in survival mode where tolerance is lost, self-attack is occurring, and we want to get you out of that into a tolerant and elective protective situation and mode. Next slide. What about that adrenal immune connection? Well, look at chronic stress. I'll let you read the right side of the slide. You see there's feedback. We always respect nature, and we never give these things we never give supplements that cause feedback inhibition. We give upstream precursors. We give the sources. We give nature's sources so that the body, well nourished and well hydrated, can take advantage of what these feedback loops are all about. On the left side of the slide, you see the deep brain talks to the anterior pituitary that then talks to the adrenal, but other hormonally active glands. And the adrenals produce glucocorticoids. Those are autocoids, stress hormones, and other factors in balance to communicate with the immune defense and repair system that then feeds back to the brain that says, hey, I got more defense work to do. Call out the deferred T and B cell responses. So if you look at the right bottom, you see these stress hormones, glucocorticoids or autocoids, and catecholamines regulate cytokine expression, immune cell activation or suppression, and bacterial proliferation. So this is very important in terms of our overall capacity to rebalance and get back into homeostasis or be lost in the river of chronic affliction and disease. Next slide. A metaphor is a teeter-totter. Maybe you remember as a child playing on a teeter-totter. If it was balanced, it was fun. If one side weighed too much, then the other side just got hung up in the air. Here you see what happens to most people with an overburdened immune system. So much defense work that the repair deficit accumulates. The immune dysfunction makes it a critical need. There is a critical need today and more than ever to tune up immune systems now, and we have been spending decades refining and improving the personalization of this approach, and that is ready for prime time for you today. Next slide. Part of the reason we exist is because we can find the hidden immune burdens. These are the delayed hypersensitivities. These are the delayed type hypersensitivities that are very hard to find because the reaction, the symptoms occur 3 hours to 3 weeks after exposure. And very often the symptoms are global, not specific. The reactors, things that drain vitality, make people feel unwell. They say they're get up and go, got up and went, and they can't find it anymore. Well, we want to restore those people out of survival mode into elective protective mode. Next slide. Here you see a representation that we have popularized over the last decades. You see that there are 4 types of reactions. Hypersensitivity, allergy reactions come in 4 different subtypes according to Jill and Coombs. Type 1 are the acute RAST IgE histaminic responses. That is measurable by skin testing or by RAST serum testing. But then the hidden, the delayed, the more important, type 2, reactive antibody B cell reactions. Type 3, immune complex, what's called vasculitis and glomerulonephritis. And type 4, T cell mediated, either protective immune responses or not. You need a cell culture, preferably an ex vivo cell culture, to measure these delayed hidden allergies. They're hard to identify by even a perfect history or any serology, that is use of serum, say to measure antibodies, where you don't know whether they're good or bad. You miss the immune complexes, you miss the most important T cell reactions, and then you can get very confused clinically. On the next slide, we see reactions in this high sensitivity LRA, high sensitivity lymphocyte response assay. The high sensitivity LRA that we develop and offer is a cell culture test. On the left are non-reactive lymphocytes, on the right are reactive lymphocytes. I'm pretty sure you can see the difference, so can we. That's why we have less than 3% variance on thousands of consecutive blind split samples. On the next slide, we see the comparison of a standard ELISA, say as you would do for an ELISA IgG or IgG4 test. It's a 5-step procedure, and each step adds 3 to 4% variance, which means the best you can do is plus or minus 15 to 20%, whereas ELISA ACT LRA is novel. It is a one-step ex vivo process where the antigen coded on the bottom of the well or the plate is exposed to an antigen-presenting cell that wiggles over to the lymphocyte at its HLA point of locus and activates through the cell-rich plasma a specific kinase, as you see on the bottom right of the slide, in the glycocalyx, in the surface of the cell, and this kinase enzyme causes the glycocalyx, these glycoproteins, to phosphorylate. That means they're more charged. They push away the plasma and the other cells. And the same kinase enzyme sends a message to the nucleus that tells the cell to divide or induce mitosis. We have shown less than 3% variance reported at a high complexity meeting called EB, Experimental Biology, just a few years ago. This was many years of consecutive, over 4,000 blind split samples analyzed over that time. So high precision and now predictive in outcome studies. Next slide. For those of you who are technical, this is the results presented at the 2016 Experimental Biology. It was 3 years of consecutive blind splits, and I want to call your attention to the, not the one on the far right, that was how many years, but the next one to it. Percent items unmatched was only 2.25%, plus or minus some narrow window, which means we had less than 3%, we had better than less than 3% variance. We had high precision reproducibility on almost all of the tests over years without, this is consecutive data. We didn't drop out, we didn't select the data in any way. The American Society for Investigative Pathology gave us the privilege of presenting this, and we have done so there and in other places, and continue to advance the cause of high precision ex vivo lymphocyte response assays in clinical practice and their interpretation with lifestyle programs. On the next slide, in regard to successful outcome studies, we did one in fibromyalgia. We biased it against ourselves, and we found in just 6 months of best efforts, this group of people, mostly in the Milwaukee, Wisconsin area, had 50% less pain, 70% less depression, 50% more energy, 30% less stiffness. This was reported in the Journal of Musculoskeletal Pain some years ago with my colleague Patricia Doister, also a fellow of the Health Studies Collegium. On the next slide, you see the results from 2 different diabetes studies. In both cases, there was a more than 1% decrease in the hemoglobin A1C in the type 2 diabetes, that's the acquired adult, so-called adult diabetes, and also in the type 1 insulin-dependent diabetics. In the type 2 diabetics, there was an 18% reduction in insulin levels, suggesting better function of insulin because we think of less metabolic acidosis, less immune disruption, and more competent essential nutrition. We have tens of thousands of cases over 30 plus years to confirm success. We published the diabetes study briefly in Diabetic Medicine some years ago, and we have much to share in regard to how we apply this for all of the inflammatory autoimmune conditions, for all of the conditions that people are chronically unwell and suffering and afflicted by. On the next slide, we do include a health appraisal questionnaire, what we affectionately call an HAQ, health appraisal questionnaire. This helps guide supplements, lifestyle recommendations. There is a rotation diet option. And then we have a joy in living the alkaline way of evoking healing, nature's alkaline way. This is now almost 35 years old, and we update it regularly. It has lifestyle suggestions of how to use food as medicine and medicine as food, and follow our guidance for substitution of reactive items while you are restoring digestion, immune defense and repair competence, neurohormonal balance, and resilience. On the next slide, we just want to mention magnesium. This is what is nature's stress buster. The hypothalamic pituitary adrenal axis is regulated through magnesium, because if you have enough magnesium to balance calcium, it reduces ACTH, you get better cortisol DHEA balance, better homeostasis, less distress, less stress hormones come across the blood-brain barrier, It reduces systemic inflammation, which is really repair deficit. It protects the brain from depression. So magnesium, very important. And on the next slide, you see how to determine how much magnesium you need. On the next slide. And we recommend 220 milligrams of elemental magnesium with a teaspoon of choline citrate 2 to 4 times a day. This enhances the uptake and corrects the choline and citrate deficits that are too common. Magnesium, as you see on the left bottom of the slide, magnesium displaces toxic minerals and protects fats in transit. Choline is the source for acetylcholine, cholinergic bile that's more soluble, and choline to balance inositol at the cell membrane. Citrate energizes and alkalinizes the Krebs cycle, the mitochondrial battery of the cell. So you get a triple trifecta benefit when you take your magnesium with choline citrate based on first morning urine pH. On the next slide, when you have 6 or more hours of rest, you can use a strip that you pee on or pee in a clean glass and dip the strip in. And if it goes sandy color, you're too acidic, you need more magnesium choline citrate, you need 3 or 4 doses a day. If it's green, you're in the 6.5 to 7.5 range. Now you only need 2 doses a day. And if it's blue or purple, consistently, that could be catabolic illness, and we should consult on what to do to get you out of catabolic illness. Again, we have chapters on these questions and the benefits of polyphenolics, for example, but urine pH after rest should be in the green zone, 6.5 to 7.5. Then maintenance is just 2 doses of 220 milligrams of elemental magnesium with choline citrate. If you're too acidic, we want more doses of the magnesium choline citrate to buffer those acids. We also want to reduce your body's production of the excess acids. And if you have catabolic illness, we want to get you out of that back into elective protective mode. On the next slide, we're taking a brief look at something that is very much in vogue right now, the gut-brain connection. So the central nervous system talks with the gut nervous system through the bidirectional vagus highway. And this influences everything from motility and secretion of mucins that allow you to have easy bowel movements. It has to do and influences the uptake of essential nutrients in the gut, where very often there is some degree of atrophy and repair deficit. And we want a healthy microbial balance. We want to support healthy neurotransmitters, stress, anxiety, mood, behavior, as you see on the right, all in relation to the microbiota, the gut microbiome. And we have ways of restoring at every level different digestive functions, and they form a quartet that we highly recommend. As you see in the next slide, there is a stress dysbiosis relationship. Distress causes the brain to misbehave, from psychological issues to abnormal behavior, as you see in the upper right, to cognition deficits, anxiety, even autism and visceral pain. And the gut-brain axis, well, that has to do with the neuroendocrine, the neurohormonal system, the neuroimmune systems, the autonomic nervous system, the enteric, splanchnic nervous system. And the intestine has to do, as you see in the lower right, with functional GI disorders, IBS, Crohn's disease, ulcerative colitis, post-infectious IBS, much more common today with people eating processed foods, much less common with people eating whole foods that they can digest, assimilate, and eliminate. And if you look to the left, you see how important the microbiota is. A healthy microbiome is biotic, not dysbiotic. This means healthy GABA, 5-HTP precursors, short-chain fatty acids, something called peptide YY, which has to do with digestion, and inflammatory cytokines derived from fats. So we want a healthy gut-brain connection, whereas most people have a distressed and afflicted central nervous system, gut nervous system microbiome relationship. And on the next slide, we look at the gut-thyroid connection, because there's always a connection. If you look at the left, You start from the top, we see a damaged intestinal barrier that increases intestinal permeability. That's the activation signal for the immune defense part of the immune system. That means essential micronutrients for the thyroid are often reduced: iodine, copper, and healthy iron, ferrous, not ferric iron. And healthy selenium, selenomethionine, bioavailable zinc to aid the conversion of T4 to T3 at the cell membrane, vitamin D that regulates immune responses. And what is all too common, as you see in the lower left, are Hashimoto's thyroiditis, which is Graves' disease, or celiac disease in relation to dysbiosis. On the right, you see the thyroid gland, how important vitamin D is. Most people need more than they have, and drops under the tongue are the way to get it. The microbiota intestines are responsible for our sufficiency or micronutrient deficiencies. When you don't have enough iron or iodine, when you have impaired thyroid hormone synthesis, when you lack selenomethionine and bioavailable zinc, that decreases conversion of T4 to T3. T3 is the active form, T4 is a precursor. Probiotics are helpful, especially when they're alive. And probiotics can, to some extent, reverse dysbiosis when you get enough of the good in. But this means fiber, prebiotic fiber, probiotic organisms, symbiotic recycled glutamine, and now we have just added a digestive, that is drops that stimulate stomach function so that the rest of digestion can be enhanced. On the next slide, I want to say again what I just said, which is prebiotic fiber, 40 to 100 grams a day from whole foods and dietary supplements. Probiotic bugs, 40 to 100 billion a day from live dairy-free organisms. Probiotic foods like live kimchi or live sauerkraut or live fermented vegetables. Symbiotics, recycled glutamine, 1.5 to 6 grams a day. We recommend taking 1.5 grams on rising and before bed, and then an extra dose before exercise or any stressful evening out. So 1.5 to 6 grams of the recycled glutamine, along with 40 to 100 billion colony-forming units of probiotic bugs, along with 40 to 100 grams per day of chewable prebiotic fibers. And now, because so many people have stomach digestive issues, we have developed and are just introducing the world's best prebiotic digestive drops that stimulate stomach digestion so that the rest of the benefits from prebiotics, probiotics, and symbiotics can be fully realized. On the next slide, we want neurochemical harmony. Active meditation, mindfulness practice improves the function of oxytocin, that's the cuddle hormone, acetylcholine, that's a helpful neurotransmitter that keeps you calm, dopamine. Now, norepinephrine is in relation to flight, fight, or fortitude. There's a third choice. There is a choice other than run away or fight, and that is to stay at the calm center. With fortitude, with practice, you can have the choice of flee, fight, or have fortitude. We want enhanced uptake tryptophan to convert into the body into serotonin and melatonin as needed, assuming you have enough B complex, magnesium choline citrate, and other essential cofactors. On the next slide, we also have a synergistic effect with dichro or dichromatic lights. These are 150 watt par 38 dichro green lights. Green harmonizes and calms the pineal gland. It reaches the pineal gland via the retina. One layer of the nerves in the eye, in the retina, wire directly to the pineal and help give it the sense of green is harmonious, blue or red is unhelpful. Green harmonizes, the others impair and afflict. It promotes restorative sleep. It improves digestion, biodetoxification, and the whole sense of being under pressure. Yes, you get better sleep, better ability to concentrate and be productive, better perception, better moods, all from green dichromatic lights. On the next slide, If you want a deeper dive, please join the PIH Academy. There is a viral protocol that we recommend. It reduces risks, boosts immune defense and repair, and stays healthier using hydration. You should be well hydrated during the day. You should have a first morning urine pH check, and you should adjust your magnesium choline citrate based on that. You should get restorative sleep. You should digest, assimilate, and eliminate what you eat without immune burden. You should have good quality air to breathe. You should have the buffered ascorbate, nature's fully buffered, fully reduced L-ascorbate based on your C cleanse, or however you determine it. You want bioavailable zinc and other minerals, macro and micro. You want polyphenolics that are zinc ionophores like quercetin dihydrate and low molecular weight OPC. The safer polyphenolics are recommended for lots of reasons, including being zinc ionophores. You want vitamin D with a goal range of 50 to 80 based on drops under the tongue to bring you into that 50 to 80 range. And you want liver and detoxification support. We have formulations specific for the liver. We have other triple detoxifiers that we pioneered in the late 80s and that have become more and more helpful to more and more people over the decades. Health Studies Collegium Foundation brings us into the 21st century for immune and hormonal tolerance, resilience, vitality, elective, protective, gratitude for living, not just getting by and surviving. So thank you for the privilege of listening. May you all be well and happy. Please take us up on the opportunity in the 21st century to be well and happier. Thank you.